Today we're going to discuss setting up a Swan on a patient that just arrived from open heart surgery, okay? You have an arm board. You should have an arm board, and you should also have your 2-inch silk tape. You will tape your op mod to the blue side of the board. And your secondary person is doing this for you while you are getting a report from the OR. So what takes place when the patient arrives, after y'all get things settled, the anesthesia will start with a report first, then Craig will start a report after that, and then Dr. Hoffman will give you a report. So all that is kind of going on while your secondary person is taping your Swan. So you have your silk tape, so you kind of make a little barrier around your op mod and then tape it around the side, and kind of pinch the sides so it holds it in place. So you should have 3 pieces of tape once you are getting ready to tape your Swan, okay? So I start with the top first, and then I use my next one. You need about 10 or 12 inches of tape, and you tape the bottom, because the biggest goal that you want to make sure you maintain is that this cord, this op mod, is straight on your board, okay, for accurate numbers. Same thing here. You can do a little wall and kind of pinch it around it and tape it around the board. Your third piece of tape holds your lines and things in place. It doesn't really have to be that big. It's just really another piece of tape to hold things in place. Let me stop right there for 1 second and say, always remember your infusion port you should leave out kind of to the side, and your wedge syringe leave kind of out to the side. The purpose of that is because if your Swan is out and Dr. Hoffman needs to advance it a little bit, then you have that. You don't have to take the tape and stuff off. As a safety thing too, let me remind you, a lot of times this is the way the patient will come back from the OR with the syringe on your wedge like this. Keep in mind too, this is a specific syringe. You cannot just put a regular 3cc syringe on this Swan. So as a safety thing, what I do is I will close it off to the patient, take my syringe off, take the air out, put it back on, open it back up to my syringe, pull negative pressure, and then close it, take my syringe back off, and take the air out. Just as a safety measure. You don't want the balloon to accidentally become inflated if the patient rolled over on your Swan or what have you. So that's just a safety thing and protects the patient. So on to our third piece of tape. You keep your infusion port and your little balloon line out as well. So you just kind of tape it across the top, kind of just like this. That's kind of left out, and this is kind of left out. And this too just basically holds your lines and stuff in place. And that's how you tape. That's how the Swan should be taped. It shouldn't be taped to the bed. It shouldn't have, this is typically, it's nice and neat. You're able to see all your lines and cords, and that they're appropriately secured on your arm board. Your pressure bag needs to be taken and hung above the patient. Always make sure that your pressure on the bag is pumped up to where you see the little green mark, okay? Sometimes just the movement of the patient from the bed from the OR to the bed, sometimes it gets knocked off or gets undone and some air comes out. So you just make sure that that's a safety thing that you're doing with your assessment, is you're checking to make sure that you can see your little green line on your flush system, okay? So once we're doing that, we will talk about the 3 lines and having your things hooked up, all that is hooked up inappropriately. We will look at now what your Swan is at. We will talk about how you measure. So remember, each mark is 50 and the small mark is 10, okay? So this is going into the patient. So if this is 50 and 60, this is about 55. And so you're measuring right at the obturator of where the Swan is, okay? And that's pretty much as far as the components that you need to set up your Swan.